Aortic stenosis is a problem where the valve between the left ventricle and the aorta is narrowed. Normally, the left ventricle is the chamber which pumps blood to the entire body through the aortic valve. So, when the aortic valve is narrowed, either it could be due to infection or could be degeneration because of aging, the aortic valve will get narrowed. So, this disease is called aortic valve stenosis. This is a disease usually of the elderly people, that is beyond 50 years of age. When there is an aortic stenosis, if the severity is mild, the people do not experience any symptoms. But if the disease is severe, even if though the disease is severe in the early phase, the patient might not have symptoms. So, early stages of severe aortic stenosis, patient might not have any symptoms. Whereas, in the advanced stage of severe aortic stenosis, the patients can develop predominantly chest pain, also called as angina in medical terminology. So, chest pain which increases on walking or any other form of exertion and gets relieved on rest or stopping of that particular exertion can be called angina. So, patients with aortic stenosis, because the heart is unable to pump for the requirements of the body, because the aortic valve is narrowed, so that is when these patients can experience chest pain or angina. The other symptom what the patients can experience is breathlessness. So, breathlessness means on walking or on lying down flat, sometimes the patients can develop a difficulty in breathing, which is commonly expressed as breathlessness or dyspnea in medical terminology. So, whenever a patient with aortic stenosis is having a fixed reduction in the blood supply to the various organs, the blood gets pulled up in the heart and goes back or reverses back into the lungs, which is responsible for the breathlessness. Finally, in very advanced stages of aortic stenosis, the patients can develop a sudden loss of consciousness with spontaneous recovery. That means episodes of loss of consciousness, also called as syncope in medical terminology. So, the predominant symptoms of aortic stenosis are chest pain, breathlessness and sudden loss of consciousness. At the same time, patients with aortic stenosis can develop an impaired ability or the functioning of the heart, which is called as heart failure. So, patients with aortic stenosis can develop heart failure also. It might even be in the intermediate or a moderate degree of aortic stenosis. Aortic stenosis patients, because of a reduction in the blood flow to the various organs of the body, it was thought that patients with aortic stenosis will have low blood pressure. This is not true of the current epidemic of aortic stenosis which we are seeing. Currently, patients with aortic stenosis are mostly elderly in their 60s, 70s, 80s and 90s. So, these patients, because of the progression of the age and hardening of the blood vessels, they develop high blood pressure, also called hypertension in medical terminology. So, patients with aortic stenosis are no exception. Contrary to what was thought initially, current day aortic stenosis patients are having more and more severe high blood pressure scenario. What is the impact of this high blood pressure? Patients with high blood pressure and severe aortic stenosis, the progression, that means the rate of the disease progression is much more faster. So, a patient with uncontrolled blood pressure and aortic stenosis can have the rate of progression of the disease is faster, leading to a severe aortic stenosis at a much earlier age. People with aortic stenosis and hypertension need to take good drugs. Many a time they require 3 to 4 different types of medication for control of blood pressure. A good control of blood pressure is one of the first steps in retarding the progression of aortic stenosis. People with aortic stenosis tend to have a fixed cardiac output. Fixed means because the heart cannot pump beyond a particular point because the aortic valve is narrowed, and this narrowing of the orifice limit the blood supply to the various organs of the body. So, when there is a reduction in the or a limitation of the blood supply to the various organs of the body, one of the most important problems what the patient finds is a reduction in the blood supply to the brain. So, when there is a reduction in the blood supply to the brain, it will cause syncope or sudden loss of consciousness. So, when there is a reduction in blood supply to the brain and various organs, for example, if a person exercises vigorously, there is a reduction in the blood supply to the brain causing sudden episodes of unconsciousness. This problem happens usually in people who have got an advanced or a severe aortic stenosis. So, people with severe or advanced type of aortic stenosis are asked not to participate in vigorous physical activity. It could be running, it could be jogging, it could be doing a weightlifting with a larger quantity or larger amount of weights. But at the same time, as we all know, that control of blood pressure, blood sugar, cholesterol, and effective control of heart failure are the important steps for retarding the progression of aortic stenosis. So, for effective control of all these comorbidities, a reasonable amount of exercise is required. So, for a patient with aortic stenosis, a moderate to mild forms of exercise are definitely required. But a vigorous and a severe form of exercise is definitely not to be done. In fact, what we call in medical terminology is contraindicated. That means we should not allow a patient with severe aortic stenosis to participate in a vigorous activity or a competitive sports. But for retarding the progression of aortic stenosis, a mild to moderate intensity activity definitely helps patients with aortic stenosis.